Good afternoon, ladies and gentlemen. Special welcome to members of the media, to the Diplomatic Center. Today we continue in our updates and briefing coming from the Ministry of Health with respect to our management of our COVID challenges. And without further ado, I'd like to ask Dr. Faris Al-Rawi to take us through the normal routine, followed by other members of his staff, bringing us up to date on our circumstances in COVID 2021.
Okay, thank you, Honourable Prime Minister, Honourable Ministers, members of the medical team, members of the media and the viewing and listening public. So we begin as is customary with the update for October 1st, 2021. The tests done so far at the public and private facilities now stand at 353,373, reporting 194 new positives over the last 24 hours, taking our total since March 12th to present to 50,903. Total recovered patients so far 45,182. Active cases 4,232. Those in self-isolation 3,680. Patients in hospital 290. Those in step-down 68. And those in state quarantine facilities 142. Honourable Minister will go into the vaccination figures. So Dr. Hines will begin with the EPI update, followed by Dr. Richards and Dr. Trotman. Dr. Hines?
Thank you, CMO, Honourable Prime Minister, Honourable Ministers, colleagues, members of the media, members of the viewing and listening public. The epidemiologic update for October 1st, that is yesterday, 2021, is as follows. We go straight into what we refer to as the epidemic curve, and we see the continuation of the trend that we have been observing over the past 3 months. The past 3 months being those three colors to the right-hand side, the fuchsia, the indigo, and the brown, which represent July, August, and September, where we've basically been seeing very similar numbers of cases from day to day by the date of collection, the date on which people present for swabbing. And that rolling average, although you see that dotted line fluctuating, it hasn't trended decidedly either upward or downward over that 3-month period. So we are experiencing that continued plateau that we've been describing from time to time during our epidemic curve updates. If we move to the same data looked at on a weekly time scale, you see that a similar pattern is observed where the same colors, fuchsia, indigo, and brown or orange, those weekly aggregates and those heights of bars have relatively remained around the same over the past 3 months. And in the background of that, the positivity, that salmon section, has hovered between 25 and 30% in that time frame. And if we look at what that aggregates to at a monthly time scale, we see that the month of July, month of August, and month of September have had very similar overall totals. And the salmon section at the background, again, hovers between 25 and 30%. So we're just sort of combining the data to demonstrate that what we've been seeing is a plateau. We've been seeing similar numbers of cases over a protracted period, and we are looking at that very carefully right now, as we know that we have a little bit of a change in the dynamics of the epidemic. We are aware that we have noted the introduction of the Delta variant into the population, so we are keeping a close eye on whether that changes this plateau, bearing in mind that we are already operating at some level of used capacity. We already have a certain number of new cases popping up in the population. We're not starting from low numbers, we're starting from a couple hundred a day. And that will reflect itself, as we will see, in the occupancy figures that have been represented over the same time frame. So we are keeping a very close eye as that Delta variant does what it does, and we do what we need to reduce the risk of transmission, and those things include the wearing of the masks, getting our vaccines, and adhering to the public health regulations. The demographics haven't changed significantly, still about 50-50 male-female among the positives, still the majority of those positives being in that 25 to 49-year age range. And similarly with the fatalities, just about 2/3 of them have been in the over 60 age group. The majority of them, but now it's a slimmer majority, have been among the men. Right now it's about 58% to 42% male to female. And the vast majority, over 80%, have had some form of comorbidity. again emphasizing the need or the benefit of vaccinating those with comorbidities to reduce the risk of adverse outcomes. So again, another plug for ensuring that you reduce your own personal risk by making sure to get your vaccine and reduce your risk of adverse outcomes if you have comorbidities, if you're in the older age groups, if you're in the younger age groups. Geographic distribution, again, we basically see the patterns of largest numbers of cases following the more densely populated communities. If you look at time trends, looking at week 37 compared to week 38, you see that most counties have fairly similar numbers between those 2 weeks. Some have a small increase, some have a small decrease, some have basically the same number. And again, that trend contributes to the plateau that we've been seeing, not a decided upward or downward movement, but similar numbers from week to week. And if you look at that over the longer time scale, you see that from week 25, we had a little bit of a decline in some counties, and between week 25 and week 38, those heights of bars have remained within a given range. Again, that represents that sort of plateau, whether they go up or down a bit, fluctuating, alternating from week to week. The numbers haven't trended significantly upward or downward in any of the individual counties. If we look at how we were expecting that this may have changed when we looked at the changes around the month of July and made a projection, we see that that red dotted line, which is the projection we made from the month of July, that line has shown a small upward divergence, that curve that shows that we're expecting an acceleration, but what we've seen instead is a fairly constant number of cases, so that instead of an upward curve, we basically have a straight line in terms of the increasing heights of those blue bars, representing our cumulative totals. So we'll take that over an increase, but a decrease would still have been preferable. So we're looking at the equilibrium between movement, virus, vaccine, and the other activities that are taking place, and noting that that delicate equilibrium remains with that constant increase over the past few months. So with that, I'm going to turn you over to Dr. Richards for the clinical update.
Thank you very much, Dr. Hines. Good afternoon, Honorable Prime Minister, Honorable Ministers of Health, National Security, Energy and the Office of the Prime Minister, and the Honorable Attorney General. Good afternoon to members of the health team, members of the media. Good afternoon, Trinidad and Tobago. I'll now present an update on the parallel healthcare system as of 8 a.m. today. This graph shows the net admissions, and the gap between the admissions and discharges continues to be narrow. This has been a consistent trend since the 15th of July or so. If we were to break down the total number of net admissions per week, we would note that the net admissions, or the additional number of persons in the parallel healthcare system, was slightly less than last week. So there was a relative decrease in the number of net admissions. That trend has really been one that has fluctuated from July 15th onwards, and the decreased net admissions this week is due to an increasing number of discharges. So the admissions were roughly the same, or on average the same, but the number of discharges were increased. So there was a lesser number of additional patients within the parallel healthcare system. Now, what we've done recently is to look at the number of COVID-positive patients in the parallel healthcare system from May 15th, which was the date on which the state of emergency was called. Overall, we would notice the line in green, which shows the total number of patients in the facilities, and that's 16 facilities, including step-downs. The red line, which demonstrates the number of patients in the severely and critically ill centers, or persons in the 9 hospitals, and the yellow line demonstrating the step-down patients. There are 7 step-down facilities, and these are where the recovering patients are held. And overall, there has been a plateauing from the 15th of July. As of today, there are 331 patients in the parallel healthcare system. broken down as follows: 266 in hospital and 65 in step-down facilities, with a ratio of 4:1, meaning 4 severely and critically ill patients to every recovering patient. Of course, this is a trend that we need to be concerned about, because it means that persons entering the system may progress to becoming severely and critically ill. This is another important graph that we would have noted as of this week. On the 15th of May, the state of emergency was called. Approximately 1 week after, on the 23rd of May, we recorded the largest number of patients in the 9 hospitals in the parallel healthcare system. That was 472, with a rolling average on that day of 537. A 53-day period was required to start, or at the beginning of a plateau, and this plateau has lasted approximately 79 days. On the 15th of July, the plateau started, and the number of patients in the hospitals in the parallel healthcare system was 318, with a rolling average of 170. 79 days have elapsed thus far. We continue to see a plateau, in spite of increased vaccination uptake and restrictions from the state of emergency. The overall occupancy of the parallel healthcare system today is 33%. We have been under 40% since the 15th of July, Trinidad at 32% and Tobago at 38%. This graph just shows the breakdown of the occupancies between Trinidad and Tobago, plateauing in Trinidad and Tobago with a variable occupancy in Tobago since the 15th of July. Again, the hospitals in the parallel healthcare system in Trinidad and Tobago, a consistent trend, with 6 out of the 7 hospitals being under the threshold of 75%. The only hospital above 75% is the Augustus Long Hospital, which today is at 81%. This is another graph that I would like us all to pay attention to. It demonstrates the overall ward occupancy as well as the intensive care unit and the high dependency unit occupancy. And as of today, the overall ward occupancy is at 32%. The intensive care unit occupancy is at 79%. This means that 8 out of 10 beds in intensive care units across our 9 hospitals are filled. Now, the intensive care units are the wards that require the most resources. And an intensive care unit bed is not just a bed. It requires staffing, lab investigations, ventilators, dialysis machines, in order to ensure that the patient being admitted receives the best quality of care. We looked at the intensive care unit percentages between the 15th of May, which when the SOE was called, and the 14th of July, and the average intensive care unit occupancy was 83%. Now, during the plateau phase, when we've seen a lower overall occupancy, from the 15th of July to today, the intensive care unit occupancy is at 77%, which is roughly the same. It means that even though the overall numbers in the parallel healthcare system have been low, with an overall occupancy of 40% or less, the intensive care unit beds are filled. This last graph just shows the number of patients in each accident and emergency department at 8 a.m. every morning in the traditional healthcare system, and we continue to note low numbers of patients requiring transfers into the hospitals into the parallel healthcare system. Ladies and gentlemen, as I close, I would like to reiterate 2 very important points. Firstly, the intensive care unit occupancy levels continue to be high in face of increased vaccination uptakes and the state of emergency. We now have the arrival of the Delta variant, and if we are not vigilant and we do not vaccinate, there is a risk of persons not being able to access intensive care unit beds. The Ministry of Health continues to do all in its part and has been proactive in attempting to scale or to increase the number of intensive care unit beds. However, if we have more patients than we can require that require intensive care unit facilities, there may be a challenge. Thank you very much for your attention, and I now pass you back to the Prime Minister.
Thank you very much. Dr. Trotman, could you join us now, please?
Honorable Prime Minister, ministers, members of the health team, members of the health giving team in the community, members of the media. Coming off of the message of the statistics, for us in the clinical scenario, what does it mean? It means that at times we are always faced in medical care with making decisions about who receives care. And one way we do that is by looking at a system that we call triage. We try to sort, which is what triage means. We try to sort out who would need care. And if you listen carefully to what is being said in the statistics, it is apparent that even at this time, we would have to look at making decisions about who would receive certain levels of care. And there are many systems that have been used, color systems, red, yellow, green, blue, white, black, and they mean different things. Superimposed on that, we often put ethical committees in to help make decisions. And we already have those in place in the community. We already have triage systems in place in the emergency room. And in the broader system that treats COVID, there are triage systems in place. So if we were to think about the fact that we got an overwhelming number of patients that we had to treat, we would have to apply this triage system and make decisions as to who could receive care. And we already know that there would be difficulty because at this time, 7 to 8 of our beds in the intensive care, where most of the patients end up, are already filled. So it means that if these numbers were to increase and we only have a couple of beds in hand, we would have to make decisions, very difficult ones, about who would receive those beds. Well, there are many ways for us to think about how we could prevent that. One of the basic ones that we all have been talking about is us using our basic principles, wearing our mask, washing our hands, and watching our distance. And for us, from what we can see, those patients that come to us in the hospital, predominantly unvaccinated, those are the patients that are coming to the hospital. So one way to help is definitely to get vaccinated. I want to at this time thank all of those who are taking care of patients and understand that some of the reflection that you see in those wonderful numbers, the hard work that the healthcare team is delivering. I said thank you to the healthcare team and encourage all to vaccinate. Thank you very much.
Thank you very much, Dr. Trotman. I would like at this time to address our wider circumstance with respect to the determination by the health authorities that we are in fact experiencing community spread of the Delta variant of COVID. We do not have in Trinidad and Tobago to wait until we get the full effects of that variant on our population to have an appreciation of the exposure that we are facing. It is worldwide, it is well known, it is spoken about a lot, and it is broadcast across national televisions and newspapers of other communities where the Delta variant has become either a main variant or the main variant. And what that means is that we expect, by the nature of that variant being present, it is possible and likely that there may be a higher level of infection because the variant is more infectious. It is more aggressive. People get affected more easily because the viral load is seen to be stronger. And, of course, people react to it in a less successful way if they are unvaccinated. Today, I want to ask the Minister of Health now to tell us where we are at with our vaccination numbers.
Thank you very much, Honorable Prime Minister. Good afternoon to my fellow Cabinet colleagues, Ministers of Energy, Energy Industries, Office of the Prime Minister, Honorable Attorney General, Minister of Legal Affairs, Honorable Fitzgerald Hines, Minister of National Security, CM on his team, ladies and gentlemen of the media, citizens wherever you are, good afternoon. I want to spend a little bit of time later on, not too long from now, talking about the weekend review. So I'm going to go through this table very quickly. Our total first dose to date, 580,306 persons, which represents 41.5% of the population. However, we still have another 300,000 or 400,000 to go of the eligible population, the vaccinatable population to go, because at this point in time we are not vaccinating persons 12 and under. Total number of persons who have completed their second dose of a two-dose regime, 486,691. When you add to that the persons who are in the one-dose regime, the one shot and done, 19,554, you add the 486 and the 19, you get 506,000 persons, 506,245, which is 36.2% of the population. What I want to spend a little bit of time now is giving you some more details and doing a quick weekend review, because this past week was an important week for us. This past week, in first doses, we did 13,110. We haven't seen these types of numbers now since the middle of September. That's why I'm bringing it to your attention. When you add to that the second doses plus the one shot and done, we did 26,340. So in total for this week, between first dose, second dose, and one shot and done, we did 39,450, which was a decent week. But decent compared to last week, which was a bad week. So I'm asking the population to make use of the vaccines that are available from next week. Let's keep these numbers up or even improve on them. What is helping us is our outreach activities, where people don't necessarily have to go to a health center, necessarily have to go to a mass vac sites. We are in malls, we are in markets, we are on the Brian Lara Promenade again. When I left there around 11 o'clock, we had done about 100. So that is good. St. Joseph last week we did 332. The point is, these outreach activities are helping us to boost the numbers and keep the numbers buoyant. I want to just advise the population again that 109 health centers are at your disposal to receive either the one shot and done or the Sinopharm vaccine, which is a two-dose vaccine. Whichever way you want to go, let's go. Get vaccinated. In addition to the 109 health centers, we have the 14 mass vac sites. We are doing these pop-ups on weekends. So this week, Monday to Friday, was a decent week as compared to last week, which was a very poor week. But let's keep it up. The children, 12 to 18, as of last night, we would have administered to the first dose 42,683, which is 47.4% of the eligible 90,000 school-age children. And those receiving their second shots, 30,278, which is 33.6% of the eligible population between 12 and 18. So let's keep it up this week. The One Shot and Done initiative seems to be catching on. For this week alone, we average about 740 a day. We have not seen that since we launched the One Shot and Done. And as I said, it's available in all your health centers. If that is your vaccine of choice, take it, one shot, and 14 days after, you're good to go. So that is where we are. That's our gross numbers. That's our weekend review. Before I close, Honorable Prime Minister, just to alert the country where the world is at. To date, globally, 6.3 billion, that's a huge number, 6.3 billion doses of vaccines have been administered. The fully vaccinated global population now stands at 2.66 billion. So that means 34.1% of the global population is vaccinated. The reason I raise this is that for the world to come out of this, every country has to do their best in their vaccination program. Thank you very much, Honorable Prime Minister.
Thank you very much, Minister of Health. I want to go back to the Delta variant in the community. To make one point, we are not going to get a pass. The rest of the world, where the Delta variant became present, was propagated, they suffered some significant increases and in some cases, some calamities. I'm not saying that we are automatically going to get there. I'm saying that if we don't do the best that we can do, then there's a high possibility that we too can become a casualty, like those countries where the Delta variant swept through the population with all its consequences. We are trying very hard to avoid that. And our health staff and the support agencies, I want at this time to once again identify them to the people of Trinidad and Tobago as doing human service in a pandemic. I want to point out that we, the people of Trinidad and Tobago, notwithstanding the ideas of some other people, in this tug-of-war with the virus, most of us are pulling in one direction, but there are some pulling in the other direction. And I would say that we need to acknowledge the response of our healthcare givers. Yesterday, I think it was, where they were called out to not provide healthcare. As leader of this country, I must tell you I was concerned, and I am concerned, but I was pleasantly surprised at the response of the healthcare givers in Trinidad and Tobago who stuck to their duty to those who are sick and require their attention. I want to say to that cohort of our population, our nurses and support staff, that you are in a position to bring down pain and suffering on the people of Trinidad and Tobago. By your absence from the job, you chose not to do that, and we are eternally grateful to you. Your representatives and others, your managers, have made some representation to the government on your behalf, and I give you the assurance that those matters will attract the attention of the government in the shortest possible time, and we'll address them as we are able to and what is affordable. There are some management issues which we can address in the not too distant future. Nothing is free, they all cost money, and we will see to what extent the population can afford to improve your circumstance. But we are particularly grateful that in the face of a call to walk off your jobs, that you stayed with the patients who need your care. That's the best that Trinidad and Tobago can expect. At an earlier time, before the Delta variant came here, or I think it was even known, because as the virus mutates, it goes through the Greek alphabet, alpha, beta, gamma, delta, and I think it's down to mu now. I made the point that with the best will in the world, there's a limited number of hospital space available to the population. there are a limited number of hospitals, a limited number of wards, a limited number of beds, and as Dr. Richards points out every week, a limited number of hospital professional staff that are required to stand and serve at the bedside. It's not just furniture, it's human involvement, the doctors and the support staff that go on the hospital. There's a limited number. So if the virus becomes so popular in the population and the level of infection is so high, and at a rough percentage, that I think is 15% of people who roughly would need a certain kind of care. So the large numbers of infected people will generate a certain number of people who require hospital care. And of course, if that care is not available, that is when we enter a calamitous situation. It is not that we are going to escape that by not paying attention. I have paid attention to many instances of people dealing with the inconveniences that are associated with decision making, especially as it affects them personally where they are located. And sometimes I am amazed at the extent of the complaint in its verbosity and its mathematics and other aspects, which does not at any point in the conversation acknowledge that we are in fact treating with a pandemic, meaning heavy infection of the population with a virus that could make many people sick and is killing very many people. Sometimes you hear the conversation and yes, it sounds good, it's reasonable, I understand your situation, but it has nothing to do with the fact that what you really are engaging without reference is the challenge of living, working, surviving with a killing virus. But the government will not lose sight of that. And that is why today I want to draw to the attention of the population what Dr. Richards has said, is that notwithstanding our best effort, notwithstanding what we have been doing in cautiously and carefully reopening the economy, we have to keep our eyes on the fact that our hospital bed space numbers, especially the ICU and the HDU, the high dependency unit, even as we are not talking about that on a daily basis and giving that on a daily basis, we have beds in the hospitals, we have equipment in the hospitals, we have staff in the hospitals who are specialists in the high dependency care and in the ICU. But most of those beds are already occupied by patients who Dr. Trotman keep telling us, as the virus kept staying with us and as new people being infected, what we've been observing is that most people are requiring longer and longer hospital stays. So when a person gets into a HDU or ICU bed, they don't come out in 3 or 4 days. Dr. Trotman can tell you how many days they stay. I think it's up to about, some people are there for 3 weeks or more. And that means that the equipment that we have in Trinidad and Tobago for that purpose, much of it is already in use. We might be able to add a bit more, only a bit more, under certain circumstances, but it is not an open-ended arrangement. So now that we are one of those countries with the Delta variant in the population, our next concern has to be, how is it treating with us? How are we responding to it? And what is the infrastructure in place to treat with an outbreak? That's where we're at. So let us not for 1 minute believe that because we have been in this for a long time, we have gotten away from it. And that God is a Trini, and we're going to just be able to cope with it just like magic. No. We have to cope with sick people by providing them with the care they need, which is hospital care, if they require that, and the support staff, and of course, the ICU beds, and all that go with that. That's where we're at right now. We're in a different position now than we were 2 months ago or even a month ago, because as we have told that people who did not travel, who are reporting as having been found to be carrying the Delta virus. Remember, the numbers you're hearing, that's not all of it. Not everybody who comes down with COVID is tested, right, in such a way to determine whether they are, in fact, carrying that strain of the virus. The sampling that goes on there, those numbers you hear are just from that sampling, right? But maybe if you check every single person, you may find that the numbers are larger. But the fact that they picked it up in the community out there means that it's out there. And we have to pay attention, because this is the most dangerous stage that we would have been in, because this variant is more aggressive than the original version of the Lambda version or other ones that existed. So that's where we are now. And it's against that background of hospital care availability where we have to pay attention to two things. One is the capacity to provide healthcare so that the healthcare system does not collapse. If we are overwhelmed by the large number of people coming to the hospital at any one time for that care, that overwhelming could, as it has done in other countries, result in a collapse of the system. We have to try to avoid that at all costs. And that is why we have to pay attention to the infection levels to keep it down. And when I look at the national geographical distribution of the numbers, the absolute numbers, if Dr. Hines puts up his bar chart there for a moment, could you put that bar chart, the one with all the main bar chart, which shows the geographical areas? Next one, all the most bars. One's the most bars. Ah, that one. Yeah. If you look at that bar chart, that is the country at a glance. The western corner, each bar is a month. Different colors show you different months. A week, sorry. Each bar is a week, and the colors show you. The western corner, that is County Caroni. The eastern corner is County Victoria. These are the main areas in the country where we get the largest numbers of persons who are supposed to be infected. But more worrisome, close to the eastern corner, on my right, is Tobago. And if you look, Tobago is second from the right. If you come 4 down from the right, you see St. George West. St. George West is one of the most populous areas in the country, coming from the eastern side of Port of Spain, the hills of Laventille, coming all the way to Carenage, Diego Martin, all Maraval, all around there. And the report from there and Tobago are pretty much the same. I'm concerned, and we are concerned about Tobago. It's either one of two things. It's either the efficiency in identifying everybody in Tobago who is infected by COVID, so you get a good number because everybody's being identified, or it is that the level of infection in Tobago is relatively high and is picked up in that kind of scale. Now, if you look second from the left, that's Nariva Mayaro. That's where Tobago was for most of our management of the COVID crisis. But Tobago has now taken on a different profile. And I say this as a word of caution to the people in Tobago, that we're not making this up. That is scientific data. Those are the circumstances. And of course, the scientific data says that this pandemic is now a pandemic of the unvaccinated, meaning that the people who are not vaccinated are the ones who are likely to suffer the worst condition. So here in Trinidad and Tobago, fellow citizens, with the best will in the world, we took a long time to be there, but we are there. The Delta variant is among us, and we have in our population approximately 300 to 350,000 people who could be vaccinated, because our target remains the same, 900,000. We have vaccines in hand. Minister, how much do we have in hand now?
Yes, I will give you the figures now, Prime Minister. We brought into the country 1.795 million. We have administered to date 1,086,000. We have a balance of 712,913.
Okay. So vaccines being the best way to respond to the virus, we have that many vaccines available, different types, brands, and so on. And we ask you not to be brand shopping because they all do the same thing. It's for the same purpose. So we have vaccines, but we also have almost 400,000 people who could be vaccinated if they choose to be vaccinated. And we are appealing to those people, get vaccinated and make our national population a population that is in a position to respond better for the fact that we are vaccinated, and as people get infected, they won't require that level of hospital care. They will stay out of the IC units and they will stay out of the HD units, and the death rate would fall among persons who have been infected. That is as much as I could say. That's what the science tells us. That's what the medical practice tells us. I know there are other considerations, and I'm not here ignoring the fact, as some people have to deal with, that there are some people in the population, a certain percentage, who, even if they want to be vaccinated, they have constraints and cannot be vaccinated. Those persons, we take that on board, and of course, wherever the requirement for vaccines are, for vaccinated persons to be operating, provision is made for the CMO office, the district medical office, to provide those persons with the exemptions that they need to identify them and therefore allow them not to be treated as unvaccinated by choice. So, as per the plans that we've been following, we did say that on the 4th of October, our schools will be open to forms 4, 5, and 6. Today is October 2nd. So come Monday, we expect that we will have a certain number of students who can come out to school. And let me explain why let me explain the thinking behind what we are doing. We've made a firm decision that we will vaccinate as many of our children who have to go to school as possible. Initially, I must admit, I expected that there would have been a greater response to that because it was such an integral part of the planning program in fighting COVID-19. And I was so concerned, and the country is so concerned about the fact that our children have been home for so long, being deprived of that period of their life where schooling is, in fact, the sanction for the development. And we did say that if we had a fairly high level of uptake, then it would be a lower risk for the virus to spread among them. And of course, we have a fair number of teachers and support staff vaccinated. I do know that there are some who are not, but that being so, we put that in the context of where the children live and operate outside the school environment. But at school, if we have the vaccinated children and they're exposed to other people, the fact that they are vaccinated means that we could be relatively comfortable in the fact that if they do get infected, they will not be able to respond as badly as if they were not vaccinated. I've heard it said that, well, they did come out of school when we had no vaccines and they were all unvaccinated. Yes, but that was us doing what had to be done when we had no vaccines. Now we have vaccines. And we also have Delta. So we are managing this thing stage by stage. And the stage that we are at now is that come Monday, all the children who are vaccinated We expect that they will turn up at school, and we expect that the teachers will be there to teach them. And those who are not in a position to take part in the vaccinated program at school at this time, I hope some of them or most of them will join us later on. But in the meantime, an alternative would be available. And we'll try to make sure that that alternative is useful. I would not at this time engage the other discussions around it, except to say that there's a program in this country and we're going step by step. So the other aspect of our policy and program is that we in Trinidad and Tobago, we have been guided all along by WHO sanction. We are using Pfizer vaccine on our children now because it has been approved by WHO for children 12 and over, 12 to 18 age group over. We do know that in the same circumstance that caused the qualification of the Pfizer vaccine for children 12 and over, approaches have been made with good results being shown in the scientific circles for treatment of children 5 and over. And once that approval is sanctioned by the WHO, the government of Trinidad and Tobago will, as we've done before, accept such a sanction, such an authorization as useful. And once there is a vaccine that is available for this infection and it is sanctioned by the WHO, the government of Trinidad and Tobago will make efforts to get that vaccine for our children, and such a vaccine will be added to the list of vaccines for children which we have grown up with, because it is the same response. So let's get that clear from now. It's not going to be any, we're not going to be putting any man on the moon with that. If it is not approved by WHO, we will not use it. If it is approved by WHO for children 5 and over, the same way we use the rubella vaccine, we use the mumps and measles vaccine, we will add this to the list and we will fight the COVID with it. So all those who are into conspiracy theories and all those who have an issue with the vaccine because they didn't like the weather in which it came to us and so on, the government policy is very clear. Once the WHO approves it, we will be happy to use that as our guidance for safety and for suitability for that purpose. I am hoping that such a vaccine is available to us so that our young children, our primary school children can come out if we get the vaccine, because when the vaccine becomes available, we don't get it as easily as we would like. So getting it approved is one thing. The other thing is actually getting a supply. And we are hoping that we will get a supply sometime if that ever comes among us. So that is on the cards coming. When we spoke the last time, we gave ample notice that coming on the 11th of October, we will go into a safe zone arrangement in the business community. And I would like at this stage to ask the Attorney General, who has been working with the team in the last couple of weeks, to tell us what they've been doing and how this is going to work, put some clarity for those who will have to operate it. And I'm asking the national population to pay attention to what we're talking about, so you will know what is and what isn't. And for those of you who are directly involved, you will know what is expected of you, and the population will know. Our policy in Trinidad and Tobago is that we vaccinate, we operate, and at the moment, going forward, in the very near future, we will have vaccinated people operating in a way that the benefits of vaccination can allow us to operate. So, AG, could you take us forward, please?
Thank you. Thank you, Honourable Prime Minister, my colleagues, the Minister of Health, the Minister of Energy, Minister of National Security, the Chief Medical Officer and team. Good afternoon to you, ladies and gentlemen of the media, and to the listening public. In keeping with the signals and statements that we made on the previous occasions that the Honourable Prime Minister made, giving notice of two events. One, the reopening of schools to vaccinated children on the 4th of October, which is Monday coming. And then secondly, the opening of the concept of safe zones for certain authorized businesses on the 11th of October, which is 9 days from now. We have been in the course of doing a number of things. First of all, we considered all of the legal ramifications surrounding the implementation of laws. We took advice from eminent counsel. We considered it in the subcommittee of cabinet, and we will, of course, take our regulations and laws through the cabinet. Coming out of those discussions and the advice and structures that we have, we propose to have new public health regulations issued. They expire on Monday the 4th, so that's midnight on Sunday. And as is usual, the public health regulations will be issued this weekend in replacement of those that expire on the 4th. The regulations are designed to treat with two matters: schools, safe zones. And therefore, we have proposed, with respect to schools, to bring into the public health regulations the requirement that students in forms 4 to 6, and obviously the age equivalent in other schools to that, for instance, in private schools that have the terminology that doesn't use a form, if they have a grade, etc., that the age equivalent will apply, that vaccinated students would be allowed the opportunity to return to classes. We have, in those regulations, of course, calculated alongside it now the safe zones. And permit me to tell you what a safe zone is. The safe zones that we're going for are restaurants, bars, common gaming house, betting pool or office license under the Gaming and Betting Act, a cinema or theatre license under the Cinematographic Act, private members club license under the Registration of Clubs Act, a theatre under the Theatres and Dance Halls Act. Notice, not a dance hall, so no discotheques. Gyms and fitness studios and water parks. These are the businesses that are going to be described as safe zones. In constructing that law, we are putting an obligation upon the owner or operator to ensure that all employees are vaccinated. For employees to present at work, they are to be vaccinated. There is an exception, however, as you must have exceptions in the law, and what we are going to provide is that the employees have the benefit of something called a medical exemption certificate or a medical deferral certificate. And if I could just explain what those two are. The medical exemption certificate is intended to be a certificate where a medical officer, not a medical practitioner, a medical officer is to be found in the public service under the operation of the chief medical officer. So at every health clinic in each of the districts, we will have medical officers. So the public sector medical officers are permitted by the authority of the chief medical officer to issue two types of certificates: a medical exemption certificate or a medical deferral certificate. A medical exemption certificate certifies that the holder of that certificate is unable, for specified medical reasons, to be vaccinated. And a medical deferral certificate certifies that the holder of the certificate is unable, for a number of reasons, for a specific period to be vaccinated. And what are those reasons? For instance, pregnancy or breastfeeding, immunocompromised individuals, persons who have received COVID-19 antibodies, i.e. people who have just been recently infected, and for any other reason that the chief medical officer may specify. Why? Because, as you know, the World Health Organization issues releases from time to time, and the chief medical officer will then treat with those positions. If you are the beneficiary of either an exemption certificate, medical exemption certificate, or medical deferral certificate, you are obliged under the regulations to obtain either an approved rapid test or a PCR test or such other test as the CMO may approve, because, as you know, tests develop from time to time. And you are to present yourself with those certificates with a negative PCR or negative rapid test every 14 days. And those are to be kept on record and to be kept on file. So let me summarize that position. All employees will be permitted the opportunity, to be presented at work. If they are vaccinated, if they are not vaccinated, they can come to work. If they have a medical exemption certificate or a medical deferral certificate, those certificates are issued by the medical officers, not medical practitioners in private practice. This is the public healthcare system medical officers, which operate under the chief medical officer. We are also then on the safe zone side saying that all patrons must be vaccinated, and they must attend with proof of vaccination and a form of identification, and they will be permitted entry. We are also at the cusp of finalizing if there are further exemptions. The legal team will sit and work out the further exemptions that may need to be applied on that. There's certain policy positions that we will scrub over the next 24 hours. But importantly, it is material to note that we are prescribing certain fines and penalties if you are in breach of these laws. So, the fine and penalty in the safe zone structure has two sides of the equation. Number one, you have the side of the equation which is the employer. Number two, you have the side of the equation which is the patron. In that context, we are saying if at any point in time an inspection is carried out by the relevant people with authority to do that at a safe zone operator, and you find people in the premises who are unvaccinated and in breach of the requirements that we set up, there will be a fixed penalty that is presented. You can challenge it. That fixed penalty is going to be at $25,000. If you look at the patron side, and you are somebody who somehow finds yourself inside of the premises and you are unvaccinated and in breach, you're facing a penalty of $5,000 by fixed penalty. If either end of that equation, the employer or operator or the patron, produces a fraudulent document, then we are going to put that as an offense, which is a summary offense, if you willingly and knowingly present a fraudulent document. And in producing that particular point, we are prescribing a summary offense. The sum we will come up with, we will just finalize as we double check that, but it's going to be significantly higher because it's a fraudulent document than the fixed penalty notices. The use of these regulations is also going to require that, as Minister Young did say on the last occasion, we're going to prescribe that there is a form of identification for safe zones. That form is a poster, a conspicuous notice to be put at the premises, conspicuously displayed, which will say you are a safe zone, what the terms and conditions are, reminding you that you must mask wear. It's in the regulations. You must observe the public health regulations. The occupancy of safe zones will be at 50%, and you have to comply with the guidelines of the Ministry of Health in this arrangement. We are, in this construct, also calculating, as the Honourable Prime Minister mentioned a little while ago, when we get to the public health and WHO recommendation for children, it is material to note that we are already calculating amendments to the Public Health, Nursery and Primary Schools Immunization Act. That act can be amended and can include, once we have the WHO structures for the under 12s, the requirement for immunization under that law for COVID-19, and it can right now also be amended when we get to the over 12s. So that is a secondary option that we're looking at. Why am I flagging that? I'm flagging that because it is very important to note that we are under constant litigation as a country, and as the world experience has demonstrated, in many of the jurisdictions that we've looked at, in the civil law countries like France or in Europe, etc., in the Commonwealth countries, and in the non-Commonwealth English-speaking countries, the United States of America, etc., the case law has demonstrated that all around the world, laws such as safe zone laws, laws such as vaccination requirements have been challenged. Fortunately, they have all been upheld, and no court has held these types of laws to be unconstitutional. It is important to note that the country is facing a challenge to the public health regulations and the public health ordinance itself. In the matter of Dominic Triage, the Privy Council is being invited by the claimant's lawyer, Mr. Anand Ram Logan, to strike out the public health laws on the basis that they offend constitutional provisions and that the saved law provision which upholds it, which the Court of Appeal said is wrong. So I want to remind you that this country is facing a direct challenge to the constitutionality of the public health ordinance itself, that ordinance which is currently keeping us alive, and successfully so, as you've seen the data demonstrate. Over the last year and a half, heading into 2 years, the data produced from the epidemiological experts demonstrate the success factor in the public health regulations. This has been upheld by the Court of Appeal, but I want at this opportunity to put the country upon notice that the very structure that has saved us is under challenge, and that challenge will be brought at the Privy Council. I should also put you upon notice that on the 2nd and 3rd of November, at the Privy Council, 11 judges of the Privy Council will assemble to consider the fate of, in part, our saved law, based upon, in that case, a challenge to the death penalty. So as soon as the 2nd and 3rd of November, 11 members of the Privy Council, you will obviously understand that that is a very unusual number of judges, right, are going to consider whether the law set down in the case of Matthews, as it's called, Matthews upheld the death penalty for the fact that it was saved law under the Constitution. Our Republican and Independence Constitution saved certain laws, like the Public Health Ordinance, etc. So we are very soon in this country going to have a decision from the Privy Council that affects a number of our laws. And in the case of Ram Logan's attack on the Public Health Ordinance, I'm putting the country upon notice that these are not regular times as laws are being challenged. Prime Minister, is there any other matter you think you'd like me to address on that?
I won't raise anything, but I'm sure the media may have a question or two for you on it, so stand by.
Thank you, Prime Minister.
Okay, I gather that you would have observed that we do have some serious business to pay attention to and to respond to, both with COVID and without it. I want to mention, in the same way that we have gone about giving notice as to how we are progressing in going back to some sense of normalcy and living with the virus in all its manifestations, that today I want to say that we are on the Monday 4th, which is next Monday. Some school children will come out, some, our older school children. On the 11th, we will start some safe zone operations in the business community. And if that plateauing that we have been having, you see, it would have been like August, July, August, September. If that continues into the middle of this month, we would consider, there are two areas that I have been anxiously wanting to consider, but the time, the situation didn't permit, but now I think I could. The government would want to look at the reopening of beaches and also the resumption of certain sporting activities. So after the next 14 days, we will address those two issues. And depending on where we are at, hopefully we can go back to those past times. And in all of these things that we mentioned, moving from closing the door to let it pass to where we are now, the more we open up, the more we go out, the more we come out, is the more important it is for us to pay attention to our conduct, our personal behavior. The washing of the hand, very, very important. I've been told by some of the medics that I talked to that they've seen a dramatic fall in the common flu. And they are ascribing that, attributing that to the higher level of cleanliness of the hands and the way they handle transport, and also the spacing that we've been doing and the wearing of the mask, there's an extra benefit to that other than COVID. And of course, the distancing and the safe congregation. So that's a phrase that I'm using now, not that you will congregate, but because we'll be doing certain other activities, you will, like going on the beach, you will be on the beach with many other people, and of course you'll want to try to make yourself safe. And of course, if you come out to play a game of football, if we do clear out for you to play sport like that, for example, like tennis, there's no real reason why observing the protocols now that you can't play tennis, because tennis players are not operating close to one another, cricket and so on. So we're hoping that come the end of this month, we should make some more progress, providing that we do not see ourselves responding to the Delta variant in a catastrophic way. So that's where we're at for the moment, and I'll put it for you if you have any questions now to any of us. The health team is here, Minister of National Security is here, AG is here, and Minister of Health. So, you want to start with the AG? AG, they want to start with you. Give your doctors a rest, right?
Good afternoon again. So, to first of all confirm that it will be police officers and also public health officers. The matter of mandating their vaccinations is a matter of an administrative arrangement that the Ministry of Health and the TTPS can engage in, and those are discussions that we're having right now.
Minister of Health, can you answer that?
Well,
just that.
I've just answered it for you. So let me explain why. The position inside of these structures is a matter of risk and exposure. Please let me confirm that in these safe zones, you must be masked, you must observe the public health regulations. I've received a few WhatsApps asking me to clarify whether children under 12 can access the safe zones. Permit me to inform that they will not be able to do so because the public health regulations are built on the World Health Organization, and it's for vaccinated people or people with medical exemptions, etc., as we will come out. So, to answer your question, the administrative, there's some things we don't need to put into law because they can be administratively done, like closing the airport, managing the port and how many people sail on a ship. Those are administrative arrangements that can be done from within the public service.
Now, you also mentioned the exemption and the deferral notices must come from public offices.
Medical officers.
There are doctors who have private and public practice. They practice in both realms. What is in place to differentiate that this deferral letter came from a doctor, not from his private practice?
The certificate which will be issued, either the medical exemption certificate or the medical deferral certificate, is a public document that can only be issued from the public authority. So those will be the health centers, etc. So the fact that someone operates in a private practice and in the public sphere, they can only be issuing on the public sphere. For example, I might write a letter as Faris Al-Rawi from my home address, but when I write on the letterhead of the Office of the Attorney General, it's a different matter.
Let me just clarify that a little bit. For the doctor who can give that exemption must hold office in the public service. It mustn't be a doctor who has a private practice because he's a doctor.
And Prime Minister...
That's why it's a public officer conducting public business. Maybe, wait 1 second. Let me ask Dr. Parsham to clarify down to the level of the...
Yeah.
The law sounds confusing, but I'm sure the doctor can clarify it for you from an operational standpoint.
So we do have a very similar structure as it relates to other things. For example, the disability form. that we are familiar with social development. So what happens are public officers are allowed to stamp it. They have to sign it and stamp it. So you use a stamp, for example, Eastern Regional Health Authority, Northwest, you're using the public sector stamp. You should not use a public sector stamp while you're in your private office. So the same officer could go to his private office, use his stamp. He's not supposed to be doing that form while you're in your private capacity.
And that's what I wanted to get at. What would happen to that professional if he
So that will obviously, subject to actions usually referred to the Medical Board of Trinidad and Tobago, and then of course their disciplinary proceedings will take place.
And how would we know for sure that this document was signed and stamped in the public as opposed to private?
I think there's some level of supervisory role by their supervisors, CMOHs, there's senior clinicians in that jurisdiction that will have to kick in as well.
Thank you, CMO, for that. So the point is that medical officer is actually defined in the Public Health Ordinance. The Public Health Ordinance defines the Chief Medical Officer, the Minister of Health, etc. So these are defined terms at law, and the safeguards for that flow, including disciplinary action, because there are regulations that are in the law, in the public law, that treat with disciplinary action, etc. Of course, the regulations provide for fraud. If there are fraudulent activities, the regulations specifically treat with that.
Sticking with the exemption and the deferral just a little bit longer, this is my last question to you. How would you respond to people saying that the person who's given the exemption or the deferral is being punished because they have to submit, along with the deferral and the exemption, negative PCR test every 14 days? And second to that, if you go to the public offices to get a PCR test, you get automatic, I think it's 14 days sick leave. Eventually your vacation, your paternity, or your leave would be used up. Is the government looking at introducing pandemic leave for those who don't want to pay or can't afford to pay to have privately done PCR tests? So they go to the public officials and then they will be given 14 days sick leave.
So fortunately, we're not reinventing the wheel. These very issues have been discussed and determined in many courts: Guyana, Barbados, Jamaica, in the Caribbean, to name a few, in the Cayman Islands, etc., and then across the globe, right down to the European Court of Human Rights, to the French civil courts, and to the Court of Appeal. All of these have been traversed and dealt with in black and white. In coming to the podium today to speak to these matters, we took careful advice from a global perspective of what the law says everywhere and what it has been upheld. Now let's answer your question specifically. Your first question is the allegation that this is a punishment for people. The point is, the greatest punishment that we can suffer is that 8 out of 10 ICU beds are filled right now. When you get to 10, Dr. Trotman introduced a word today that I'd like everybody to walk away with. It's called triage. Dr. Trotman spoke to it. Triage means you're going to decide which patient gets treatment. In other words, then, that's an ethical system that has existed for 40 years where you decide who lives and who dies. So the greater punishment, which is what the courts have upheld, is the fact that people will die and your society will collapse. So what we have to do is to do a proportionality balance. And the proportionality here is you have 1.9 million vaccines available from start to finish to the population. Medical exemptions are being offered. And around the world, if you listen to the philosophy, after you have become in a herd immunity category, things begin to change. So this is a constantly moving equation which has been addressed in multiple jurisdictions. So I don't suggest that it is a punishment. It is to save lives at this point.
If I may. But this is specifically for those who already got exemptions and deferrals. So there is some medical reason why they can't be vaccinated. So then why subject them to 2 weeks PCR test at their own cost?
Because the science says that the risk is to be monitored. So you have to now determine whether you are infected or not. And they are going into a safe zone. So if you look at it this way, where there's a suspicion of infection, people are put on quarantine, contact tracing happens, people stay in for 7 days, for 14 days, for 21 days. This is how we've been living with this. There are approximately 5,000 people that are currently carrying the virus and are under monitoring. So because you're going into a safe zone, where the rules of engagement are, listen, this bubble is safe, both as to the people you're meeting there as employees and the people who are entering, that's what it is. The point that you need to remember is the amount of time you're going to spend. Let's picture a gym. In a gym, you're in physical contact, you're in close quarters, you're spending a significant amount of time. It's very different from a grocery, where you're going in and out with 50% capacity or monitored positions, with hand sanitization, with less contact ability. So there's a material difference between the concept of a safe zone and also the concept of other places. So we are starting with safe zones.
Reintroduction of pandemic. No, he didn't answer the part 2, with the pandemic leave.
Right. So that issue of leave has also been addressed. In fact, I will be taking certain steps to clarify that from an industrial relations point of view, because the law is extremely clear on that, and the issue of leave is a situation that is already measured. It's actually before the courts right now. Yeah.
Yes, Prime Minister Sanolala, TDT News. I'm not sure if the AG could answer. Restaurants and bars, although they will be allowed to dine in, there's been a question from restaurants whether it will be a hybrid system, whether unvaccinated people would be able to still be able to take away their service.
Yes, of course. The takeaway functions still, the curbside pickup, the takeaway functions, those are in operation already. Most restaurants allow you to do curbside pickup. It's fully in effect as we speak. So the answer is yes.
They would have to do it in accordance with the CMO's
correct. As Minister Young is correctly guiding, the CMO has issued guidelines for that, and there'd be a segregation. That segregation is continue the curbside that exists as it is, and the safe zone is, remember, the sign is at the front, and to enter, you have to qualify. So your entry is always going to be for vaccinated people.
So is it that now unvaccinated people would have to collect their takeaway orders on the outside?
Yes.
And
yes.
Secondly, from the Bar Owners Association, just want some clarification in terms of whether they will have to apply first to become a safe zone to be able to open, and what documents would they need to work with to do so.
So perhaps I should let the Minister of Health speak to that.
Thanks. So there is no application per se. The Ministry of Health has already developed a template. It's an 8.5 by 11 poster. We have decided on the fines. That goes into that now, and that will be downloadable. Once you display that, you are basically agreeing that you're a safe zone, and you are agreeing to everything, including the fines. So there's no application coming in, right?
You're representing to the world and to the court and to patrons alike that you qualify as a safe zone and you're under penalty of law. $25,000 fine, revocation of your safe zone status in the event that you've breached it in certain circumstances. Those persons who enter also have fines and penalties. If there's fraud, significant fines and penalties. So the administration of the system can work on that basis. If you are caught out, there are consequences.
No, Annalisa.
Sorry, please, sorry. Excuse me. The mask. I blame it on the mask.
Good afternoon, Prime Minister.
Annalisa.
I have some non-COVID related questions. I was just letting my colleagues get those COVID related questions outside.
We don't have the whole day. It's now almost 4
So
o'clock. So let's finish the COVID questions first. You have a couple more, and then we go on to other things, if you have other things. Jules.
Yes, so anyone who could answer, I'm sure the Cabinet would have had deliberations about, say, the safe zones, for example, and the issue of the schools for the Form 4 to Form 6 students who are vaccinated in the context of the Delta variant. How much of a concern was that? In other words, was at any point did the Cabinet look at, say, delaying these actions, or you're confident that it would be able to operate despite the Delta variant and community spread?
Well, dealing with this virus and its challenges, nothing is cast in stone. Eh? We look at the situation, past, present, and future, and we make decisions accordingly, and you would have seen that we've made changes. In the case of the ones that we are going ahead with, yes, we keep looking at it to see whether we should continue, and the answer is yes, and we go forward because we've put certain things in place, we've got certain results, we know a bit more about it, and so on. So we are always open to making adjustments if we have to.
And also in terms of, let's say, the restrictions under the state of emergency, if things go in a manner that the government is happy with, you would see further lifting of restrictions under the state of emergency?
Well, at this stage, as I said, it's still useful, but as I said at the time in the Parliament when we went for the extension, that we'd lift it at the first opportunity, that that lifting will not prejudice what we can do. At the moment, we've got a bit more time outside, 10 o'clock curfew. We will keep looking at it, and as a matter of fact, it's coming to an end at the end of November. We have another 8, possibly 7 weeks of it. So we look at it, and once it is useful, we'll go with it. It is a tool. It's causing a little inconvenience here and there. I'm pleased to report that I've not heard of a single instance of abuse by officers who are administering it and encouraging people to comply, and that's a good thing. But hopefully, when we get either close to the end of it, we probably would examine it to see what has to happen there. And if the situation warrants a discontinuation, then we'll do it. And if it warrants a continuation, then we do it.
Also, Prime Minister, sorry, I received a few questions, if I may just answer them publicly, because I think they're material questions to be answered. Kijan Haynes, thank you for your questions. Some people are asking, are the schools safe zones? And I'd just like to say that no, we're not treating the schools as safe zones. We are treating the interaction of the students in a very different way, because as we discussed it, both the team members and everyone else, you have basically one teacher to 40 students. And we are not therefore applying the same structures inside of there. Persons asked whether alcohol can be consumed at the restaurants, etc. The answer is no. That is not going to be permitted at this point in time until the Prime Minister and team come up with a policy change on that based upon the medical advice that we're receiving. Thank you for allowing that.
I was just wondering, in terms of hotels, what category do they fall in terms of the concept of the safe zones as you have described?
Well, hotels have already been the subject of operation. They are not safe zones. The hotels are operating. The hotels that have restaurants and that have bars will obviously have elements of those that apply. So if their restaurants are going to be in operation for in-dining services, then that is subject to safe zone. And that is a natural fit. So a restaurant may have a bar. There may be a restaurant or a bar inside of a hotel. If they are going to operate as safe zones, they'd have to comply with the standards and rules.
Just one more question for me, AG. In terms of bars and restaurants that are found open without the safe zone sign, is there a specific separate penalty or a fine attached to that?
Yes, there actually is, because the state of emergency regulations and the public health regulations work side by side. So if you are not, all restaurants are prohibited under the current law from doing anything other than curbside pickup. All restaurants that want to have in-house dining as a safe zone will have to comply with the safe zone positions. The factor is now that we're seeing that employees must be vaccinated or have an exemption certificate or a deferral certificate, because we're now introducing people inside the place. So there's a certain amount of management as to your back-end staff, if I could say that, your kitchen staff. Clearly you can't be operating a safe zone and a curbside pickup using the same staff that are unvaccinated without a certificate of deferral or exemption. So this is a progressive step. There's been a great deal of clamor for further and progressive opening of the economy as we balance lives and livelihoods.
Just for clarity, Attorney General, those who do not opt for the safe zones initiative, they can operate but with the curbside takeout.
That's correct.
Takeaway.
Yes.
So that's a good position on which we can shift the gears, because our management of COVID has a huge component of voluntary, non-mandatory response. So people in Trinidad and Tobago, a lot of things you can do, some things you can't do. The things that you can't do, I think, are on the smaller end. Most of it is doable, and you make the choice. People have choice. I noticed that people react very aggressively to the word mandatory. There are very little mandatory COVID response in Trinidad and Tobago as compared to many areas in the world. We do have some, and we continue to balance, the rights and privileges as well as good sense and safety. Annalisa, yes, you're anxious to change topic, right?
Prime Minister, good afternoon.
Good afternoon.
As head of the National Security Council, regarding the Police Service Commission and what has so far been played out in the public domain, I'm here to ask you to share your concerns and what sort of how do you feel in terms of the developments that have so far?
Well, having identified me as head of the National Security Council, I don't know that you will expect me to be sharing a lot of views with you. I'm required to keep my counsel on most of the matters. So unless you're very specific, about a specific matter which I may want to consider, just remember that national security is not bacchanalia.
Prime Minister, exactly. The issue that, in terms of the Police Service Commission, the AG's involvement in terms of what's happening.
What aspect of it? Because a lot of it has happened. What aspect of it? We do know that we've had issues with the Police Service Commission, but if you could be specific about, even about people.
The relationship between the AG and Mr. Kiwal saying.
I am not in a position to speak to that. I mean, that is not a national security matter. I do not know that the relationship between the Attorney General and hundreds of lawyers in the country have not been the issue for discussion at National Security Council. So I couldn't respond to that. You may want to talk to the AG about that, or Mr. Kiwal Singh or that. But as chairman of the National Security Council, I have had no input involving those two names at National Security Council.
Prime Minister, have you met with the opposition leader, the president, to discuss possible nominees for the DSC?
That is not a requirement of my job, sir. What the requirement is that the president will consult with the opposition leader and will consult with the Prime Minister as she considers nationals to fill the slots that are there. There is no requirement to meet and treat with the issues. Each office holder has a responsibility in a consultative process, but it's not a group meeting.
Have you all consulted on that issue as yet?
I have not been approached by the president with any name as yet.
Just from a standpoint of, for those who may not understand, from the parliamentary perspective, the budget will be read on Monday. The debate will begin how many days after. Let's say if in that period of time a name is put forward for nomination for post on the Police Service Commission, does the Parliament have any way of dealing with that, with the budget taking place, or it has to wait until after the budget?
Well, Parliament regulates its own business, right? But we do have some protocols that we've been following. And if what you're asking me is whether we'll treat with nominees, the budget is read on Monday, and then we're due back on Friday, is it? Friday. The response to the budget is on Friday. I don't expect that Parliament will be called between Monday and Friday for that purpose. And then the debate goes on. I don't know. You see, because in the budget, specific days are set out specifically for the debate. And I don't know that we could use or we'd want to use any of that budget debate time to do other matters, because the debate has to be closed by the following Thursday. So I think the days that are settled for the debate, we will want to keep those to treat with the budget. I want to say something though, because I've seen a lot of people, I don't want to say overreacting, but responding to the fact that there isn't a commission and there isn't a police commissioner. Understand that the police service is a place that it's a paramilitary organization that has rank and responsibility. What is absent now is a police service commission. And I'm sure that members of the commission are now discovering how important and how loved they were. So now that they're not there, they're missed. There is a deputy commissioner in place with all the authority of the commissioner. There's a deputy commissioner who is acting as commissioner. That is under challenge in the court, in case you don't know. And even if that challenge succeeds, the rest of the police service is intact, functioning as normal because of the rank situation. The sergeant is still the sergeant, the inspector is still the inspector, the senior superintendent is still the superintendent. What is absent is the commissioner and those specific commissioner things. For example, there's nobody there who will be able to do the transfers that the commissioner may want to do, or sign FULs that the commissioner alone can do. Other than that, the police service is functioning and waiting for the filling of that vacancy. And we as a country, we are waiting for the replacement of those people who have left the Police Service Commission. And I don't think that we should get overly excited about that. I've seen all kinds of things being spoken and all kinds of constitutional crisis. There's none. There's no constitutional crisis about that. We've had some serious difficulty, and as I said before, I see it being worked out very smoothly, very clearly. We are at the point now where the Service Commission has been emptied by resignation of persons who were there. Of course, there were those who were calling for it and those who were demanding it and those who were... But the bottom line is there have been resignations and the commission... So there are vacancies that have to be filled now. And I'm sure that Her Excellency is giving it a priority. And what's going to happen? The President will make... The President, I hope, will find people who are willing to serve on the commission, because that's a big problem, you know. And it's not just what you just heard there in the last couple of weeks. The biggest obstacle in the way of finding people to serve in those positions is the Integrity Commission. You may not know that. You approach people to serve in those positions, and one of the biggest obstacles in getting citizens who qualify are getting citizens who are willing. And they're not willing because they do not wish to get involved in the trauma and the inconvenience of the Integrity Commission requirements and whatever. So I am hoping that Her Excellency will find citizens who are qualified and willing, and I'm sure that there are people in the country who would want to provide public service. And once Her Excellency gets those names, and I think they are specific to certain skills, it's not every Tom, Dick and Harry, there are certain skills that the people have to have and be willing to serve. So some work has to go into it. And once Her Excellency is happy that she's found people, she will then consult with the office of the Prime Minister, with the office of the opposition leader, and then once she's happy with that consultation, the names go to the Parliament, and then the Parliament will treat with them as you have seen me treated with them. Nothing to burn down the country over.
So you say it's nothing to burn down the country over, but the acting appointment of the DCP ends on October the 15th. And the question of whether or not October 15th it ends. And the question of whether or not Gary Griffith was legitimately appointed as acting commissioner is now before the courts. The judge has given an undertaking that she will deliver that on the 14th. Provided that it's not in favor of Griffith, I suspect there will be a challenge for that. That leaves the police service without a leader from the 16th of October.
That is not true. I just told you there is a deputy commissioner of police properly appointed and is in post. And if on that day the issue surrounding the acting commissioner is extended as you have just described, the police service will just be run by the deputy commissioner of police, who is now acting as commissioner of police. That's what's going to happen.
Prime Minister.
And there's no need for the country to get capsized over that, because every superintendent will still be superintending.
Correct.
Every sergeant will still be sergeanting. Every constable will still be constabling. And the top of the police service in this situation will be the highest ranked officer in post, would be the deputy commissioner of police, who is there, who is now acting as commissioner, and his acting appointment is being challenged in the court. That's right, you're correct. But if it comes to that, there's nothing to lose your life over. It's going to be sorted out. Because once a commission is appointed, that commission will then proceed to fill the vacancy. There's no other avenue. There are some people who love the rara and trying to make you figure that the sky is going to fall in. It's not going to fall in.
Prime Minister, if I could assist, there's a lot of what this situation is not about that is in discussion. So let's just stick to the facts. There is a constitutional matter in the court. Mr. Balgobin Maraj, whose attorney is Mr. Ram Logan, has gone to the court and said, I wish to have the Constitution interpreted to say how an acting commissioner of police should be appointed. The Constitution and only the Constitution. There is no challenge to any legal notice or any order. None. The advice that the government has received, which we agree with wholeheartedly, is that acting appointments are to go to the Parliament. The President of the Republic has requested, by way of direction in writing, that the acting appointment of a DCP who acts as a Commissioner of Police, as Stephen Williams has acted, as many have acted, Her Excellency the President, who the Office of the Attorney General represents, has asked for that to be put before the court, and we have. What the Prime Minister has clearly identified is there are two things that are under the scrutiny of the court. Under one umbrella, the Constitution is being looked at, nothing else. On the 14th of October, Madam Justice Kangaloo has undertaken to give a judgment. There are very narrow legal submissions that are being put before the court, beginning on Wednesday, replies on Friday, a short hearing on the 11th, and the judge will rule on the 14th. When the judge makes her decision, we will know what the court says, and what the court will say is whether acting appointments need to go before the Parliament or not. What is actually before the court is all acting appointments since 2006. That's what this constitutional dilemma involves. But there is no crisis, because as the Honourable Prime Minister has put out, this can be dealt with by the method of the Constitution. The Constitution says how the Police Service Commission should be populated. Section 80 of the Constitution sets out that the President has a role to play, and if it says in consultation with others, then in her own discretion, and that's that. So there is a tight time frame, and the government's position is crystal clear as to it believing that the appointment for acting commissioners should go to Parliament.
So in terms of, so in terms of Mr. Griffith's position, he's the acting commissioner. By a letter he received from the commission before they resigned. That is substantive, it still stands?
Let's put the facts clear. There was a process by which the Constitution came about, and in 2006, there was an amendment to the Constitution to put in a structure which we're all aware of. It's operated for a very long time. In the Constitution, it says persons may be appointed to act or hold in an office, and then it sets out a process which, in one interpretation, which we hold, involves going to the Parliament for appointments. The President and the Office and the Police Service Commission have publicly put a different point of view, as they're entitled to do. A legal notice went via the Cabinet to the Parliament. It passed the Parliament. It was passed, successfully upheld as law. It is not under challenge. Nowhere. Despite what anybody wants to reinvent their story as, it's not under challenge. A claim has come now that the Constitution says something. The judge will decide what the Constitution says, and whatever the outcome will come about, the court will consider, is Mr. Griffith's appointment correct? Is Mr. Jacobs' appointment correct? Are all previous appointments, Stephen Williams, come down correct? Because that's what Mr. Ramlogan's case puts into issue. All appointments from 2006 onward, including from, importantly, legal notice number 103 of 2009. So all of that is under challenge by Mr. Ramlogan. What Mr. Ramlogan will have to explain to the country is why, as Attorney General, and why with Mrs. Bissar-Bissessar as Prime Minister, that was good. So please remember that this is not what they make it up to be. You have to go to the facts. Look at the fixed date claim form. Notice that in 2015, the opposition went to court and challenged the legal notice. They sought to strike it down in the case of Haridat Maraj. They went for judicial review. The court did not strike it down, it modified. On this occasion, there is no judicial review or strikeout of any legal notice. What there is a challenge that the Constitution says all acting appointments must be done by the Parliament. And that's just the end of the story.
In short, ladies and gentlemen of the media, national population, as I said the last time I was here, this whole thing is about interpretation of law. As I speak to you now, in the court, because I followed the details on last Monday and yesterday, there are lawyers for different interests in the court with different interpretations of the law as it applies to certain actions of state. And where you have two lawyers, or even one lawyer, it is possible to have more than one opinion. And that is what we're dealing with. I see some people trying all kinds of red herring and smoke herring in it. It is all about legal interpretation of the law, and we know where we go for that. That's why I said last week, right, that I expect that the processes and the institutions will be called into play, and we come out of this very clearly, very simply. Those side shows that are going on there and trying to give you all kind of... That's not what it is. If, as Jensen was saying a while ago, if the court rules, and I don't want us to jump ahead of ourselves here, but we can see what is happening. There are lawyers in the court, to and for and against. If, as the judge indicated, she is minded to rule because of the urgent nature of this matter, on the 14th, I think, by the 14th we will know what the position is. If that ruling supports the point of view that where we have been going all along, including the appointment of an acting commissioner of police without the Parliament's involvement, if the ruling then is that that was wrong, then that is the answer. Then we now know, one, that the police service will be in the hands of the deputy commissioner for a while. And then we also know that the process to appoint a commissioner can only be done by a police service commission. There's no other way. And therefore we wait until a commission is appointed. We hope that will be done very quickly. And once a commission is in place, they pick up the baton there and proceed to go through the process of appointing a commissioner. And in the meantime, the deputy commissioner is in post and will continue to run the police service as deputy commissioner. If his acting as commissioner is struck down by the court ruling, then he has another position of deputy commissioner. And under the deputy commissioner is every other rank of the police service acting as normal.
You said continue.
Mr. Hines, as Minister of National Security, one of the recommendations that came through the plethora of things was that the firearms department in the police service is now ceasing operation for the moment. Quarantine is the word. And that, the only person who can sign a firearm user's license and awarded is the commissioner. So the deputy commissioner, while he is running the police service, cannot. Right? And I just mentioned that as a statement of fact. But the rest of the police and other things that other officers can do will be done. We have a whole series of levels of police officers up there, many of whom are aspirants to the post of commissioner of police. So let's not get carried away, especially by the sprinkling of red herrings around by dirty hands.
Prime Minister or AG, anybody can answer this one. With regards to the merit list that the previous PSC would have tabulated and supposed to have sent to the President but didn't, when the new PSC comes in play, would that merit list still be valid, or would you have to start the process all over again?
That's a lot of speculation. Let me make this abundantly clear. The government has a rule. The attorney for the government, the Attorney General, has a rule. We do certain things, we take to Parliament. In this whole appointment process, our role ended when the order was upheld. That order is not even under challenge. What the Police Service Commission does, the Constitution says it does. And they act independently under Section 123 of the Constitution. What the Office of the President does is specified in the Constitution as well. So none of us have a rule on what an independent Police Service Commission may or may not do. We would be quite simply out of place to volunteer that, let alone on any speculation, because we don't know any of that.
As a matter of law, the previous PSC had a merit list. It was not submitted to the President.
But how do you know that?
But
so you're acting on speculation. Listen, office holders have to act on facts, not speculation. Facts are what we have to deal with, because if we step outside of constitutional rules, we have anarchy. We must recognize that there's active politics and agendas and, he say, she say, that's all, whatever it is. The Prime Minister's called it red herrings and smoke herrings and whatever it might be. The point is, the Constitution is absolutely clear in Section 123 that the Police Service Commission acts of its own accord, and that has been upheld by our courts as well. In the Haridat Maraj case, the independence of the Police Service Commission was again a reminder to this country. So the judgment by Madam Justice Kangaloo on the 14th is going to speak to what the Constitution says. I must say that I'm slightly disappointed that my friends in the media have not been clear as to what the facts are. You have to go to the documents. The facts are the Constitution is being asked to be interpreted, and that's what the judge will do. Nothing else is under challenge.
Just one thing, not on this concerning the safe zones, if you don't mind, Attorney General. You were very clear on the issue of the exemptions for employees in the safe zones, but those who are patrons or people going to establishments. If you did say it and I missed it, I apologize, but in terms of persons who want to go to safe zones but have reasons for exemptions, would they qualify for that as well?
So we're dealing with that now. As I had alluded to it, there are just one or two small issues that we will clarify between now and the publication. One of them is the exemption aspects for safe zones. For instance, whether we apply a PCR negative test at the door with a medical exemption. So we will work that out. Remember, we have to act in a proportionate way. Let me say, schools are not safe zones. They're being dealt with under a different regime. The safe zones are being dealt with separately. What we will be sure to have is the regulations in circulation as they are required before the 4th of October, which is Monday.
Thank you very much.
Thank you.
Trinidad and Tobago, don't play with your life. Remember to follow all COVID-19 guidelines at NLCB North Central.
COVID-19 is no game.